My name's Dr. Sarah Jarvis. I'm a GP and the Women's Health spokesperson for the Royal College of GPs. UTIs are otherwise known as urinary tract infections. We often call them cystitis because that's the kind that women get very often. All cystitis means is inflammation of the bladder. Urinary tract infections are incredibly common in women. About half of women have at least one urinary tract infection during their life, usually cystitis, and many women get far more. Urinary tract infections do occur in children and in men, but they're much less common in both those groups. The main symptoms of cystitis are burning when you pass water, needing to wee very often, pain over your lower tummy where your bladder is, and sometimes feeling generally unwell. An indication that the infection might be more serious could be passing blood when you pass water, feeling generally unwell, hot and cold, feverish, shivery and shaky all over, and pain which goes up into your loins in the small of your back on one or both sides. Most urinary tract infections are caused by an infection, and that's usually caused by a germ which lives on the outside, on the skin, around where your water comes out. Because women have a very short distance between their bladder and the outside world, it's very easy for germs to get up inside the bladder. Normally, urinary tract infections need to be treated with antibiotics, which will kill those germs. When you have a treatment for a urinary tract infection, you'll usually, in the first instance, be given antibiotics to take by mouth, and very often that'll just be one tablet to take twice a day for as short as 3 days. That may well be enough to get rid of the infection permanently. Occasionally we find that some of the germs that cause urinary tract infections are resistant to certain antibiotics. If they're resistant to the more common ones, you may need to take a longer or a more frequent course of a different antibiotic. But once you've had the urine infection cured, it's gone. That does not, however, mean that it won't come back again. Fortunately, there are lots of ways to prevent urinary tract infections. One of the most important is avoiding getting dehydrated, because if you haven't got enough water going through your system, then you're not flushing your bladder out regularly. So it is important, especially during hot weather or if you have a fever, to avoid getting dehydrated. Likewise, it's very important if you use certain methods of contraception, such as the contraceptive cap or occasionally condoms, that if you're getting a lot of cystitis, you should talk to your doctor or family planning nurse about whether another alternative would suit you better. Drinking cranberry juice can be a good way of avoiding cystitis, and just one glass of cranberry juice drunk once or twice a day may prevent you from getting more attacks. You will very often find that if you're having frequent sex, then you may be more prone to cystitis. So it's important to prevent cystitis to perhaps wash before and after you have sex, to empty your bladder before and after you make love. And when you go to the toilet, always the wipe from front to back so that no germs are lying around the entrance to your bladder. If you have very early symptoms of a urine infection, for instance just a little bit of burning just when you wee, or needing to wee slightly more often, you may be able to get rid of it simply by flushing it through your system by drinking lots and lots of fluids. You can get rid of some of the early symptoms with medicines that you can buy over the counter from your pharmacist without a prescription, but that won't necessarily cure the infection. So if the symptoms persist, or certainly if you get the more serious symptoms, such as passing blood in your water, feeling generally unwell, hot, cold, shivery, feverish, or having pain in your loins, it's essential to go and see your GP.